Today we will discuss about the mid-sagittal section of the head and neck, as well as we will discuss about the pharynx, lateral wall of nose. First of all, I will just introduce some parts of the mid-sagittal section. This is the portion of the superior pox cerebri, and inside the pox cerebri there is two sinuses. Above there is a superior sagittal sinus and inferior sagittal sinus. This is the between the cerebrum and cerebellum. It is the tentorium cerebelli. Opposite side of the section you can see there is a clear cut pox cerebri. You can see this is the partition between the two cerebral hemisphere. And here you can see inside the pox cerebri inferiorly there is an inferior sagittal sinus, and this is a gap into the two layer. It is a superior sagittal sinus. This is the tentorium cerebelli, and this one is the portion of the pox cerebelli. Here you can see this is the pox cerebelli, and this one is the tentorium cerebelli between the cerebellum and cerebrum. If I will just elevate this fold of the pox cerebri, here you can see, if I elevate this pox cerebri, you can see the opposite side of the medial surface of the cerebral hemisphere. Now we will discuss about the pharynx in this specimen. Here you can see this is the nasal septum. I have cut this nasal septum into the midline, and you can see, if I elevate, you can see this is the lateral wall of the nose. First of all, we will discuss about the pharynx boundaries. Pharynx is the musculofacial tube extending from the base of the skull. So this is the base of the skull. Here you can see it is the musculofacial tube. Here you can see this is a hole is the pharynx, and it lies behind to the nasal cavity, behind to the oral cavity, and behind to the larynx, laryngeal larynx. So it divides into the three parts. The upper portion, it is called the nasopharynx. The middle portion, which is called the oropharynx, and the lower portion, it is called the laryngopharynx. So it is situated from the behind to the nose, behind to the oral cavity or mouth, and behind to the larynx. It is act as a common channel for deglutition as well as respiration. So the nasopharynx particularly, it is concerned with the it is only for the airways, while the middle portion oropharynx, it is mainly concerned with the both the things, deglutition as well as it is concerned with the air, and the laryngopharynx only concerned with the passage of the food. The length of the pharynx, which is from the base of the skull to the lower border of the cricoid cartilage on the back sides, it is the length, it is 12 to 14 centimeter. Upper part of the pharynx, which is the width, that is 3.5 centimeter. Lower portion, it is 1.5 centimeter in breadth. The boundary base, it is formed by the posterior part of the body of the sphenoid bone. Here you can see this is a posterior part of the body of the sphenoid bone. This is a sphenoid sinuses, and this is the body of the sphenoid bone, as well as it is a basilar part of the occipital bone. So this is the basilar part of the occipital bone. This is the upper boundary of the pharynx, and the inferiorly pharynx, it is continuous with the esophagus. Here you can see it is continuous with the esophagus, and you can see this is the esophageal tube. It becomes continuous as an esophagus, and this is the lower border of the cricoid cartilage, and it is called the pharyngoesophageal junction. It is the narrowest part of the esophagus. Posteriorly pharynx, it is gives the gliding moments by the prevertebral fascia, which separate it from the cervical spine, and it is posteriorly, it is related with also C1 to the C6 vertebra, it is a posterior relations of the pharynx. Anteriorly it is communicated, above portion it is communicated with the nasal cavity by the three concha, superior, middle and inferior concha, and middle it communicated with the oral cavity by the oropharyngeal isthmus, and below it is communicated by the through the laryngeal inlet, it is communicated with the larynx, and most lower part inferiorly it is continuous as a esophagus. So we will discuss about the part of the pharynx. It is the upper part, it is called the nasopharynx, middle part it is called the oropharynx, and lower part it is called the laryngopharynx. The nasopharynx, it is the part above to the soft palate. This is the soft palate, and above to this portion of the nasopharynx, behind to the concha, this portion of the pharynx, it is called the nasopharynx. So it is above to the soft palate. Superiorly it is limited by the body of the sphenoid and basio-occiput. This is the sphenoid bone as well as the basio-occiput. And it is communicate anteriorly with the nasal cavity, we already discussed, and posterior nasal aperture, and inferiorly it is communicated with the oropharynx at the pharyngeal isthmus. This is the pharyngeal isthmus. It is bounded anteriorly by the soft palate, posteriorly by the pacement pits, and this is the elevation of the soft palate. During the deglutitions it closes the soft palate, and same times there is elevation of the dorsum of the tongue or root of the tongue, it elevated, and the food which is goes downside, it is the second stage of deglutition. At that the same times this epiglottis, here you can see this is a epiglottis, which is goes on the back side, and it closes the laryngeal inlet, and the food which is passes inside the laryngopharynx, and then it is goes inside the esophagus. Inside the nasopharynx we will see the structure. There is a opening of the auditory tube. This is the opening of the auditory tube, and this auditory tube, it is also called the tubal opening or pharyngotympanic tube opening or Ischiarian tube openings. Just above to this opening there is an elevated area. This elevated area, it is called the tubal tonsil, and this tubal tonsil, it is the upper and posterior to the tubal opening and produced by the lymphatics. It is called the tubal tonsils. The tubal tonsils, on the back side, on the posterior sides, there is a one fold which is goes downside, and this fold, it is called the salpingopharyngeal fold, and it is contains the salpingopharyngeal muscles. It contains the salpingopharyngeal muscles. Anterior to the tubal openings, there is a one fold. It is called the salpingopalatine fold because it is from the tubal to the soft palate. It is a salpingopalatine fold, and it contains the levator palatini muscles. Just behind to this tubal opening there is a recess, groove. It is called the pharyngeal recess. It is called the fossa for Rosenmoller, or it is called the pharyngeal recess. It is a depression behind to the tubal elevation. So just behind to this tubal elevation there is a depression. It is called the pharyngeal recess or fossa for the Rosenmoller. Just behind to the tubal elevations there is a fossa. It is called the pharyngeal recess, and behind to it there is a elevated area. It is called the pharyngeal tonsil, or it is called the nasopharyngeal tonsil, and it is above, it is continuous as the same one. It is continuous as a pharyngeal hypophysis, and inside the pharyngeal tonsil, or it is called the nasopharyngeal tonsils, there is a depressed area. It is called the pouch of Luska. This is the pouch of Luska. In there is a depressed area. It is very difficult to see, but it is a mucosal diverticulum inside the substance of nasopharyngeal tonsil. It is called the pharyngeal bursa, or it is also called the pouch of Laska. Just above to the pharyngeal tonsils, there is a continuations. On the upper part, there is a elevated area. On the base of the skull, it is called the pharyngeal hypophysis, and it is nearly the similar structure to the adenohypophysis. And inside there is a groove. It is called the Rathke's. It is called the Rathke's pouch. Sometimes this pharyngeal tonsil or nasopharyngeal tonsil, which is enlarged inside the mainly in children, but after the puberty it is the atrophies, and during the childhood enlargement it lead to there is a difficulty in swelling, so the child feel a breathlessness. Now we will discuss about the oropharynx. Here you can see this is the oropharynx. Above it is bounded by the soft palate and the palate itself, and below it is bounded by the laryngeal inlet, particularly epiglottis. Anteriorly it is bounded by the dorsum of the tongue or back side of the tongue, posterior surface of the tongue, and posteriorly it is bounded by the mainly the first, second, third cervical ribs and the pharyngobasilar fascia, prevertebral fascia. It is posteriorly it is bounded, and also mainly just behind to this mucous membrane there is a superior constrictor muscles also lies behind to it. Posteriorly the oropharynx, it is bounded by the vertebra C1 and C2 vertebra, and the above it is bounded by the soft palate, below it is bounded by the epiglottis, and anteriorly it is bounded by the dorsum of the tongue or posterior surface of the tongue. So anteriorly this oropharynx, which is communicated with the oral cavity. Here you can see this is the oral cavity by the oropharyngeal isthmus, and inside the oropharyngeal isthmus, here you can see there is a two fold. The anterior fold, this one is the anterior fold of the oropharyngeal isthmus. It is the palatoglossal fold and it contains the palatoglossal muscles. Posteriorly there is a fold, it is called the palatopharyngeus fold, and this palatopharyngeus, it contains the palatopharyngeus muscles, and this area it is called the tonsillar fossa, and inside there is a palatine tonsils which is situated, and the area in between the dorsum of the foot, dorsum of the tongue, it is called the isthmus. This area of the tongue, it is called the isthmus, which is communicated anteriorly with the oral cavity, and posteriorly it is communicated with the oropharynx. So this is called the isthmus or fauces. So you have to remember two isthmus. One is the pharyngeal isthmus. This is the pharyngeal isthmus, and this is the oropharyngeal isthmus. Pharyngeal isthmus, it is on the which separating the nasopharynx and oropharynx, and the pharyngeal isthmus, which is separating the oropharyngeal isthmus, which is separating the oral cavity and oropharynx. You have to remember. Now we will discuss about the Valdier rings. Valdier rings, it is a collection of the lymphoid tissue. Particularly here you can see this is on the laterally into oral cavity or oropharyngeal isthmus. This is the here just under beneath to the mucosa. This is a palatine tonsils. On the dorsum of the tongue, there is a tonsil. It is called the lingual tonsils. There is a pharyngeal tonsils, or it is also called the nasopharyngeal tonsils. And just above to the auditory tubes, there is a opening. Above it there is a tubal tonsils. These four tonsils, it is called the which prevents the infection from the nasal cavity as well as from the oral cavity, and it protects. So it is called the Valdier rings. Now we will discuss about the laryngopharynx. It extends from the epiglottis. Here this is the epiglottis to the lower border of the cricoid cartilage. This is the lower border of the cricoid cartilage, where this portion behind to the laryngeal inlet, particularly the larynx, behind to the larynx, it is called the laryngopharynx. So it is extend from the upper portion epiglottis to the at the lower border of the cricoid cartilage, behind to the lower border of the cricoid cartilage, where there is a portion, it is called the pharyngo esophageal junctions. And this is the, here you can see, this is the larynx, and here inside the larynx you can see also this is a vestibular fold, and lower one it is called the vocal fold. So above one it is the vestibular fold and below one is the vocal fold. But here right now we will discussing about the laryngopharynx. So it communicates anteriorly with the upper part by the laryngeal cavity. In upper part it is communicated with the larynx by the laryngeal inlet, and this laryngeal inlet which is formed by the above anteriorly it is formed by the epiglottis, on its side it is formed by the aryepiglottic fold, and posteriorly there is a arachnoid cartilage. So this is the laryngeal inlet which is on the both sides, which is formed by the anteriorly by the epiglottis, on each side it is formed by the aryepiglottic fold, and inside the aryepiglottic folds there is a presence of the aryepiglottic muscles, and posteriorly it is formed by the arachnoid cartilage. It is the boundaries of the laryngeal inlet. So anteriorly this laryngopharynx, which is communicated with the through the laryngeal inlet to the communicated with the larynx, and below it is continues as a below to the cricoid cartilage, it is continuous as a esophagus by the pharyngoesophageal junctions. Above this laryngopharynx, which is communicated with the oropharynx, this is the oropharynx. So basically three portion of the pharynx. Upper portion it is called the nasopharynx, behind to the nasal cavity, behind to the oral cavity. The portion, it is a common pathway for the food as well as for the respiration, it is the oropharynx, and behind to the larynx, the portion, it is called the laryngopharynx. Posteriorly, this laryngopharynx, which is concerned with the 4, 5 and 6 cervical vertebra. Laryngopharynx, it is not only behind to the larynx, but it is projected on the lateral aspect, and here you can just see behind to this aryepiglottic fold. This is the aryepiglottic fold from the epiglottis to the arachnoid cartilage. This between fold, it is called the aryepiglottic fold, and laterally it is also extended, and this fossa, it is called the pyriform fossa, and this pyriform fossa it is the extended just on the lateral aspect of the laryngeal inlet, and sometimes there is a food which is imprinted inside the particularly fish bone, which is imprinted inside the pyriform fossa, and it damage to the internal laryngeal nerve and superior laryngeal artery. Nerve supply of the pharynx, it is supplied by the all the muscles of the pharynx, which is supplied by the spinal accessory through the pharyngeal plexus, and except stylopharyngeus, which is supplied by the glossopharyngeal nerve. The sensory nerve supply particularly into the nasopharynx by the pharyngeal branches, which is coming from the pharyngeal plexus, particularly coming from the pterygopalatine ganglion. Particularly sensory nerve supply of the pharynx inside the nasopharynx, it is branches coming from the maxillary nerve inside the nasopharynx. It is a sensory nerve supply, and it is coming from the pterygopalatine ganglion, while the oropharynx, the nerve supply by the glossopharyngeal nerve, and inside the laryngopharynx it is supplied by the internal laryngeal nerve. It is a branch of the vagus nerve. So three different nerve which gives the sensory innervations to the pharynx. Particularly you have to remember, some books also mention inside the nasopharynx some portion which is also supplied by the facial nerve, but mainly it is a maxillary branch from the maxillary nerve. It is a branch of the fifth nerve, and it is through the pterygopalatine ganglion. It supplies to the nasopharynx. Oropharynx we already discussed. It is supplied by the glossopharyngeal nerve, and laryngopharynx it is supplied by the internal laryngeal nerve. Particularly, it is a branch of vagus nerve. So this is the nerve innervations, and blood supplied of the pharynx by the ascending pharyngeal, facial, lingual, and maxillary artery, and it branches supplied to the pharynx. Vein, it is formed by the pharyngeal plexus of the internal jugular vein, and lymphatic, it is the inside the deep cervical lymph node. So this is about to the pharynx. Hope you enjoy and understand the pharynx. We will discuss some structure of the mid-sagittal section of the adenoid. Here you can see this is a spinal cord, and this is the covering of the spinal cord, and there are three covering: pia, arachnoid, and dura mater. And this is a vertebra and intervertebral disc. Here you can see, and also this is the sphenoidal air sinus, and this is the medulla oblongata, this is the pons, this is the midbrain, and this is a cerebral peduncles which is connecting to the cerebrum. This is the cerebellum, this is the cerebrum, this is the corpus callosum. It is a commissular white fiber, and it is a four part. The most anterior part of the corpus callosum, it is a rostrum, this is a genu, this is a body, and this is a splenium. Other structure we will discuss inside the lateral wall of the nose. Here you can see this is the soft palate, and this one is the hard palate, and this is the oral cavity, and this is the muscles of the tongue, and mainly the muscle of the tongue, mainly the main muscles of the tongue, it is a genioglossus. But we will discuss during the tongue lecture intrinsic and extrinsic muscles. This is the nasal septum, we have removed it, and you can see this is the lateral wall of the nose. This one is the superior concha, this is the middle concha, and this is the inferior concha. Here you can see this is the sphenoidal air sinus, which is open above to the superior concha by the sphenoethmoidal recess at this level. Below to the superior concha there is a opening of the posterior ethmoidal air sinus, and just below to the middle concha, here I will just elevate this middle concha, and you can see this is the hiatus semilunaris, and inside the hiatus semilunaris you can see there is a opening of the anteriorly frontal air sinus. Middle there is a anterior ethmoidal air sinus, and posteriorly there is a maxillary air sinus. And the elevated area, this portion of the elevated area just above to this hiatus semilunaris, it is called the bulla ethmoidalis, and inside just under beneath this bulla ethmoidalis there is a opening of the middle ethmoidal air sinus. Below to this middle concha, this is the inferior concha, and just below to the inferior concha there is a one opening, but it is difficult to see here. There is a opening of the nasolacrimal duct. If we can cut all this concha, then we can see all the opening easily inside the lateral wall of the nose. The basically lateral wall of the nose, which divide into the three parts. This is the mucocutaneous junction between the atrium and vestibules. This is the vestibules, and it is the vibrissae, and inside the hair, inside the wall of the lateral wall of the nose. Here you can see this is a vestibules, and there is a hair inside, it is called the vestibule, and this is the mucocutaneous junction between the vestibule and atria, it is called the limen nasi, and there is a agar nasi, it is just anterior to the upper boundary of the atrium, it is called the agar nasi, and just behind to the atrium, the portion, it is called the concha. There are three concha: superior, middle, and inferior concha. We will not discuss here the blood supply and nerve supply of the lateral wall of the nose, but you have to see inside the books and you can read yourself. Thank you very much.